Osteoporosis. What is osteoporosis? Osteoporosis, in simple words, is bones with holes, which means bones lose important minerals such as calcium more quickly than the body can replace them. As a result, the bone becomes less dense, lose strength, and can break more easily, thereby increasing the risk of fractures. Usually, osteoporosis has no signs or symptoms until a fracture happens. Hence, it is often called as silent disease. How common is osteoporosis? Osteoporosis is commonly seen in elderly people aged above 50 years. Women are more likely to develop osteoporosis than men. 1 in 3 women, 1 in 5 men are at risk of osteoporosis. Understanding the basic function and composition of bone. Bone. It is a tissue made of collagen and minerals such as calcium that gives strength to the bone. Composition and function of bone. Osteocyte helps in maintaining bone. Osteoblast helps to form bone matrix. Osteoclast resorbs the bone. Osteogenic cells are the surface lining of bones and in bone marrow. What happens during osteoporosis? During osteoporosis, the activity of bone-eating cells or osteoclast are more than bone-forming cells or osteoblast. Osteoclasts excessively breaks down the bone cells. Osteoblast helps to form bone matrix. Bone resorption, bone formation. Factors or causes that increase the risk of osteoporosis. Age, menopause, alcohol, smoking, family history, long-term use of medication such as corticosteroids, lack of physical activity. Stages of osteoporosis. With menopause, slowly normal bone mass reduces and becomes more porous or osteoporotic. This results in back pain, loss of height, and increases the risk of fracture. Typical posture. Normal bone mass. Bone loss. Vertebrae begin to deteriorate. Height loss begins as spine loses support. Reduced bone mass. Osteoporosis. Vertebrae may crumple, resulting in back pain, lost height, and a hunched posture. Osteoporosis bone mass. Diagnosis and treatment for osteoporosis. Diagnosis of osteoporosis. Bone density is diagnosed by dual energy X-ray absorptiometry or DXA and quantitative computerized tomography or QCT. Treatment for osteoporosis. There are different types of medicine which help to minimize bone loss, risk of bone breakage, and enhance the bone build-up. However, your doctor may prescribe the medication depending on your condition. Complications associated with osteoporosis. Osteoporosis, if left untreated, can increase the complications which may lead to fractures. Common sites for fractures: hip, spine, wrist, humerus. Healthy tips to maintain healthy bones. Follow a fit and active lifestyle. Be physically active and exercise regularly. Practice right exercise and postures. Exercise such as aerobics, climbing stairs, dancing, jogging, yoga, etc. Take the prescribed medication on time as directed by your doctor. Exercise helps to increase bone strength and maintain bone density. Increase muscle strength. Mobility. Reduces pain. Follow a healthy diet. Include calcium-rich food in your diet, such as dairy products, green leafy vegetables, cereals and oatmeal, etc. Include vitamin D in your diet, such as fortified milk, bread and juices, and through supplements. Adequate exposure to sunlight in the early morning. Reduce risk of fall and fracture by using carpets and area rugs to have a skid-proof flooring. Using non-skid rubber mats. Wearing appropriate footwear such as low-heeled shoes with rubber soles. Avoid unhealthy behavior and practice. Overexercise. Being inactive. Practice high-impact exercise. Carbonated soft drinks. Alcohol consumption and smoking. Cluttered floor and slippery wax on bare floor. Unattended oily or liquid spills on floor. Walking in socks, stocking or slippers. Stopping medication unless told by your doctor. Ask your doctor to know more about osteoporosis and how you can prevent future fractures.